Now, let's just have a small overview on how the blood collection bag looks like, and then we see how we now directly collect blood from the patient. So this is a cartoon of a blood collection bag, and it has numbers. Now for the number one, the red part is now the blood bag, where we expect the main collection of our blood to be. Then we have number two here that is in white. It is our blood bag label. This will contain who is the donor, what is the number of donation, especially if you are collecting in mass, what is their blood type. If sometimes you ask them, of course, after still in the laboratory, we are going to do the typing and confirm. I mean, the details of where you collected it, at what time was it collected, what type of blood or blood component is it, among other information. Every information that is relevant for us to be able to understand this collection. And then we have the sampling bag, which is this small blue bag here that you can see, that also has a vacutainer holder at the bottom, because here is where now we collect the samples that we need to take to the laboratory for further investigation. So this sampling bag allows us to do pre-donation blood. Before we can allow blood to get in here, you can see we have some clamps here. Before we can allow blood to get into this blood bag, we first collect, okay? We first collect uh, pre-donation blood, and this is diverted so that we can sample it, as well as the first blood, of course, as you start collecting, is likely to have skin cells, or maybe even the cleaning site, maybe it's povidone, iodine. I mean, whatever you have used to clean up the area before you do venipuncture. So this is very important. We collect, at least ensure that there is no bacteria or any other contamination that gets into the blood bag, as well as help us to sample the samples that we need for further investigation in the laboratory. Then we have clamps. These are pinches on the tubings to create a seal. This a little bit darker blue here, and there's also another one here. Now when you don't want blood to flow here, you clamp. When you don't want it to flow here, you clamp. And of course the vice versa. If you want it to flow, you unclamp. Then we have the tubing, of course, the one that is coming from the venipuncture needle. Here, the one that goes into the sampling bag, and also the one that goes into the blood bag. Then, of course, you have the needle and shield. Here, number 6. So the needle and shield is now what we do venipuncture to draw or deliver the blood into the sampling bag as well as the blood bag. And it is shielded to avoid any injuries, especially during transport and storage. Now, this is just a small illustration of different types of bags we have. We will be looking at blood components at some point, and we will see which one is collecting what. But we can have what we call a single bag. Maybe you just want whole blood. We can have a double bag. Maybe this will collect whole blood and also collect maybe platelets. We can have triple bag, and we can have quadruple bag. So this we'll discuss also more when we come to discussing the blood and blood components. So this is just now the real picture of the blood bag, which is important for your appreciation. Now, what is the blood collection procedure? So I've just used this cartoon to help us see. These are things I'm sure you do almost every day in your laboratories, in terms of generally taking blood from the vein. And of course, the very first thing is to put a tourniquet or a cuff, because this way we apply blood pressure to raise the pressure so that we are able to target and get blood flowing into our blood bag here. Of course, must be thoroughly cleaned site, so that we ensure we are not also contaminating our gloves, contaminating anything around this arm area. And then Of course, the donor is asked to also clench the fist until the veins become prominent so that we can be able to insert the needle. Then, of course, this site where we are collecting from the vein needs to be sterilized. We can use tincture iodine. We can also use chlorhexidine. And then after that, of course, we need to keep the blood bag. We have now inserted the needle. Normally, the blood bag must be kept at a lower, below the venesection site, so that there is easier flow of blood. And as the blood enters the tube, we need to expel the bead or the clamp. In this case, it's the clamp which prevents blood from entering the bag. So if you want it to go to the sampling bag, of course, open the clamp on the sampling bag and then close it so that now you allow it to get into the blood bag. And of course, after we have had the blood going, we'll need to keep to reduce the pressure of the calf, and of course mix the blood carefully so that it mixes with the anticoagulant, and now it is ready for storage. So of course we need to label and also ensure we have at least 4 to 5 tubing segments or vacutainers that you have already gotten from the sampling bag so that you can use them for further testing and screening, and then allow the blood to cool down, because at this temperature is around 37, the body temperature, before we can do refrigeration. And of course, this period should not exceed more than 1 hour. You can't cool it down for more than 1 hour. It's just for a few minutes to ensure that the temperature has cooled, then we can do refrigeration. So donor care during donation is very important. That is when they arrive, during, and also after. So donating blood should be a pleasant experience so that I can be able to also go back. The venue should be safe. Sorry. The venue should be safe for the donor and should also be comfortable. Get good seats, of course, and they are clean. Ensure that they adequately address any adverse reactions that could be there, such as fainting, feeling dizzy, and then also facilities should deal with any reactions during and after donation. So, of course, the staff must be well trained with interpersonal skills and should always be smart in appearance to ensure high level standards of hygiene. And of course, be taught or trained on how to have pleasant manners and converse freely with donors at the time of donation to make them feel comfortable and willing to do it again. And then an act of carelessness, of course, and lack of professionalism by the staff during and after donation can of course make sure that they don't come back again. Then after we have done donation, then we need to at least ensure that the donor sits within the chair for 8 to 10 minutes so that at least there isn't any adverse reactions like feeling dizzy. If they relax for 8 to 10 minutes, they'll be okay in most cases. And then observe at least another 10 minutes in refreshment area while the donor is having maybe a soda or something to eat so that they can, replenish their blood, as well as also inspect the venipuncture site before the donor leaves to ensure that there is no swelling that probably has occurred, or that there is no more bleeding that is still occurring. Of course, very important, thank your donors, and this is asking them to write how they probably have felt, their suggestions, their comments in a register, and of course thank them later so that they can generally come and do regular voluntary blood donation. Essentially, we never have enough blood, so blood donation should be taken very seriously in terms of making donors feel comfortable and appreciated. Yeah, so of course, instruct them to ensure that they drink more fluid in the next 24 hours, that they shouldn't smoke at least in half an hour after they have done donation, and then continue with daily routine, but they should avoid extremely strenuous work like weightlifting at least for 24 hours. They shouldn't drive in the next half an hour, and then the volume loss due to blood donation should be replenished by the time it's 48 hours, and they can safely donate afterwards, and then report in case there is any adverse reaction. Yeah, and then of course, as the laboratory technician or medical personnel involved, ensure you document any adverse reactions, if any, on the donor card and donor register. Yes, that is it. On that first part, I just have these three questions and I want us to answer them.